My name's Mark Diana. I started at Tulane in the summer of 2007, just shortly after Katrina. And my training is in health services, organizations, and research. My main area of interest is information systems. So the main course I teach in the master's program is health information systems, which is a course that surveys issues around managing information in healthcare organizations primarily. I also teach in the doctoral program a course in organizational theory and a course in research methods that really sort of helps bring together all the different pieces of doing a research project. My main area of interest in research is the use of information in healthcare organizations and how people use that information to provide care and deliver services more effectively and safely and hopefully for less cost. Whether that happens or not, is an open question. So I've studied mostly hospitals in the US and the implementation of electronic health records and that kind of thing. I've also done some work overseas in Mexico in particular. I've done some work looking at the development of electronic health records and how they're being used to support delivery of care and collection of information about the performance of the health system in general. I'm also doing some work around health system strengthening, which is this effort to try to improve health systems in low and middle income countries. And I find that to be fascinating. It's an area I wasn't originally working in before I came to Tulane, but Tulane's offered a lot of opportunities to get involved in that kind of work, and so it's been a real fascinating exercise to get into that area. My training is really not as a public health practitioner. I was trained primarily as in health services and health management. And so I was hired here to be in the group of health systems management policy. My background has been in health services delivery primarily. So joining the School of Public Health has been a real interesting experience for me to get a sense of the wider questions around population health and improvement of the healthcare of everybody, as opposed to the service delivery setting, which is really focused on once you've gotten illness. So it's a fascinating area to be involved in, and it sort of widens the exposure and the opportunities for what you can do. And I personally find the sort of synergy between the two sides, the health services side and the population health or public health side, to be critical. And in the US, we haven't always done a very good job of that. So it's really interesting for me to be involved in this area. Okay, my advice for prospective students looking to get into public health in general, or whether it's health management and policy or some other area in public health, is to think very carefully about what their career goals are, where they want to be when they're done with their education. Obviously, employment is a piece of that, but it's also what their aspirations are, what they want to do, and what they want to try to accomplish. Because the real key is to match the training you're getting with the goals you want to achieve when you're done. So I always ask students, where do you want to be when you get done with the program in 5, 10 years? It's not always easy to answer that question, but thinking about it and making sure the fit is right is probably the most critical piece.